Hi, I'm Dr. Daria Klachko Totten.
And I'm Dr. Michael Nusbaum, and welcome to
HealthTalks.
So I want to talk today about some of the side effects and complications of testosterone replacement,
Right.
hormone replacement.
And
for
this
men.
is in men. Okay.
This is in men. There aren't a lot, but there are significant things you need to keep an eye out for.
Right.
So, as you know, there's a cascade of hormones. So
Right.
testosterone kind of breaks down into other things. And one of them is actually estrogen. And so you really need to be careful about getting too much estrogen, because too much testosterone, if you're too high, that'll break down into estrogen and you'll end up with gynecomastia, man boobs, and some other issues that you really don't want to have to deal with. So it's really important to not go too high in your testosterone, but also to be getting blood work regularly.
Right.
Obviously, once you hit an ideal testosterone dose, it's pretty good
Then
for quite a while. Yeah, you don't need to do it every month or every
okay.
3 months, but you need to be getting it regularly, and it's really important to do that.
Talk to me about like how often, if you start somebody on testosterone, how often do you have to test?
Yeah, so I usually do blood work every month until we find that kind of ideal dose for the patient.
The sweet spot.
Yes, and then I go to every 3 months, and I go to every 6 months. I don't know if annually is really a good idea, because you're going to miss some things in some patients.
Right.
So you really need to be keeping an eye on it. And some of the other issues are, change in urination, which would be related to prostate issues, usually BPH. Some prostatic hypertrophy.
So the testosterone can cause that, or increase the chances.
It can increase the chance of that
Okay.
happening. So if you have changes in urination during testosterone replacement, you need to speak to your provider, and you may need to stop it for
And
a
those
while.
changes are hesitancy to urinate. Like, what are those kind of changes?
Difficulty starting your stream,
Uh-huh.
but any change in urination, you really should inform your provider. It's important to know about. The next thing is an increase in blood pressure. So the increase in blood pressure is actually due to an increase in your hemoglobin.
Okay.
You think that's actually a good thing, but actually if it gets too high, it could be a bad thing. So you really need to keep an eye on that too. If your blood becomes too concentrated, your blood pressure is going to go up, and you could have a hypertensive crisis, and you could literally have a stroke. So, and you hear about this about some people taking testosterone from the back of a gym. They're not sure what they're getting. They're not being monitored. So you really want to be careful, and that's really important too. And honestly, if you're on testosterone replacement, you should probably be checking your blood pressure on your own. And I do recommend my patients do that. And if you do see that happening, the treatment is really to donate blood. Interestingly enough, I've had some
phlebotomy is.
Drop the hemoglobin a little bit. I've actually had a patient with interesting side story. He never got vaccinated, and went to get his blood donated to try to decrease his hemoglobin, and they actually really wanted his blood because he had never been vaccinated. I'm not sure what that was about. I know, very
that's
strange.
Interesting.
So he was telling me that they call
never been vaccinated for anything.
No, for COVID. Sorry,
okay.
the COVID vaccination. So I'm not sure what that's all about, but that seemed very strange.
Very
but they're after him for his blood. You need to donate blood if your hemoglobin goes up. And the other thing I want to be careful about is testicular atrophy, your testicles shrinking. That also could be due to the testosterone levels being too high. There are medications and treatments for that too. Once again, you need to talk to your provider.
Is that reversible?
It can be reversible, absolutely. If it goes too far, though, there's kind of a point of no return where you're not going to be able to get them back. So you should be doing self-checks. Just like women are doing breast examinations, you should be checking your testicles regularly, looking for any lumps, but also changes in size. As far as the estrogen goes, we do have estrogen blockers. I typically put an estrogen blocker and anastrozole into the injection, so it's kind of mixed, so everybody's getting a little bit of that along with it to try and monitor or keep the estrogen levels low. So once again, if you're on testosterone replacement, hormone replacement therapy, you need to be getting your levels checked, blood levels checked regularly. If your estrogen is too high, you need to come down on your testosterone and increase the estrogen blockers. If your hemoglobin is too high, your blood pressure is too high, you need to donate some blood. If your testicles are shrinking, there are medications to fix that.
Thank God.
Exactly. Well, I'm Dr. Michael Nusbaum.
Dr. Daria Klachko Totten.
And thank you for joining us at HealthTalks.
Bye.
Bye.